Have you ever been in a room where you were the only one of your type, be it race or gender or ethnicity or any type? How would you like to be treated if you were the only one in the room of your type? Now, this is a common experience for patients with mental illness. When medical students or people who are starting in mental health field, they start their rotation for psychiatry, generally they're a little bit anxious. Same thing for cops. When they're called into a situation where somebody with mental illness is agitated, many times they don't know how to respond. And sometimes loved ones don't know how best to respond. And that primarily it is from not knowing how to treat or talk to patients with mental illness. With this experience of exclusion for mentally ill patients is endemic. So many of the words that were used initially for a type of mental illness also became slang words, or society in general doesn't treat our mentally ill patients the same way. It's surprising that if you or your loved one has a stomach ulcer or a cardiovascular problem or heart or lung problem, you won't experience shame. But if you or your loved one has psychiatric illness, that induces the feeling of judgment or shame. It's amazing that, and the most complex organ in our body is brain. It has 100 billion neurons, and all those neurons are communicating through neurotransmitters, and we just assume it should always work perfectly. Every other organ could get sick or could have a problem, but for some reason, if brain had it, that means it's a weakness. And that's the notion that we need to change and challenge. Another common misconception is that if for somehow it is the weakness of faith or trust in God. And that is certainly not true. While religion could be a source of strength and support, but mental illness or depression is not because of the sins or because you're not believing in God. Actually, most religions would agree that children are innocent, and most of the mental illnesses start in childhood or adolescence. So we definitely need to change that notion as well. And another misconception is they could be more violent, and that is also a myth and not true. Actually, psychiatric patients are more likely to be the victim of the violence rather than the perpetrator. Substance use or alcohol use or addiction would count separate, particularly when people are intoxicated. That is aside. In general, for the rest of the mental illness, your patients are not going to be most likely violent. The only person they are violent towards frequently are themselves. So, and this is the only type of pain that leads a person to the point of ending their own lives. Now, in today's advanced medicine and sciences, while we are reducing morbidity and death from other causes, the deaths from suicide are still increasing. And the morbidity or illness, disability from depression and anxiety is significantly increasing. So 1 out of 4 or 5 people are experiencing some sort of mental illness, most common being depression and anxiety. So we must reduce this stigma, increase awareness, and treat patients with mental illness with compassion rather than judgment. In reality, people who are dealing with these mental illness and are seeking help are stronger. It's like two people are walking the same distance. One is carrying extra burden or extra weight all the time on their shoulders. It takes significantly more effort for them to do what others are doing without that burden. And what Kelly Clarkson put in her song, "What doesn't kill you makes you stronger." And that philosophically, that is true, that does build your resilience. And for the population or the group where we do worry about is the ones who do not seek help. And that is what you increasing the awareness, treating them with compassion would make it better. Do you have that ever had experience of grief or sadness? How would you like to be treated? With kindness and compassion, and not with the judgment for your emotions. And another thing, for those who are working in mental health field, we could be the moral witness for telling others that this is not their fault, and it does not make them weak. And if somebody is judging them, they're wrong. So recently I had this experience where in a shopping mall, some person ahead of me, he was not so nice to me or used some judgmental words. And the cashier, she said that sorry about what he said, that was rude. And in some ways, her saying that, being that moral witness, was so soothing that I actually forgot the actual pain of the initial words. And words are powerful. So choose your words carefully, communicate with kindness, and again, just like you would treat any other human being, same way you treat patients with mental illness. If they give you feedback, or with verbally or non-verbally, then respond to that feedback. Be kind and let them know you don't mean to hurt their feelings if it happens. But if you are aware and being mindful, the likelihood of that happening is already low. So thank you so much for listening, and be well, take care of yourself, and seeking help is a sign of strength.